All right, so we're going to talk about the pathology in the retina. So retina is this purple membrane right here, this part of the eye, and retina consists of different layers. So you have the sclera, the choroid, and then the retina has Bruch membrane, the retinal pigmental epithelium, and the photoreceptors, and so forth. So what are some common pathologies of the retina? First of all, you have ones that are vascular. Then you have, of course, the age-related macular degeneration, and then the retinoblastoma. For vascular, you have diabetes and hypertension. I'm going to abbreviate it as HTN. For diabetes, you basically have two kinds of diabetes, proliferative and non-proliferative. Remember that proliferative eventually turns into non-proliferative. Proliferative is non-proliferative. Usually the non-proliferative eventually turns into proliferative. Non-proliferative is characterized by macro aneurysms. Okay, hemorrhages. Proliferative is usually it's because of hypoxia, and it has neovascularization. And to make it a little bit easier, I'm going to put this in different color so you can see it. Neovascularization means that there are a lot of new blood vessels. Hypertension is characterized by a couple of things. So basically, you have copper and silver wires. And what that is that all the arteries in the eye, all the blood vessels have become very thick. So when you shine light on it, it reflects the light really, really well. So that's why it looks like copper and silver wires, thick arteries. And then it's also characterized by cotton wool spots, which is basically the thickened nerves. Okay. You also have artery occlusion, so that's another one. Central renal artery occlusion. Sorry, spelling. And that's that is characterized by cherry red spots. So cherry red spots. I'm gonna draw a cherry for you. So cherry red spots. And then you have age-related macular degeneration. That is going to be characterized by a few things again. You're going to have drusen, which are basically fat deposits. In the retina, you also have neovascularization. So you have neurovascularization all the way from the Bruch membrane to the retinal pigment epithelium, actually from the choroid to the retinal pigment epithelium. You have, of course, it's based genetics, smoking risks, and also the treatment is going to be VEGF factor. VEGF factor is a cause for it. So anti-VEGF factor is going to be a treatment. So this should give you an overview of the different diseases in the retina.